one of the reasons I work, besides the fact that I love what I do, it's very important for me to have my daughters see mom going to work and doing something that she feels is important to her. Because I think that if they see that, they will not only look for something that they're passionate about, but they'll hopefully understand the value of hard work and overcoming challenges, because I do have challenges every day.
Welcome back to How Are You Arriving? I'm Cristina Young, and I'm excited to tell you about the next series of episodes I'm hosting. This next theme is called Passion-Driven Work. I so admire the kind of people whose work isn't just about a paycheck, but also about purpose. Passion-driven work is what happens when a cause, a belief, or a commitment calls us and we answer. Some jobs we choose because they're practical. Others choose us because of what we believe in, who we want to help, or the difference we hope to make. Those are the stories we're diving into. What does it look like when work is fueled not only by skill, but by conviction? When what we do is tethered to what matters most to us. Welcome to How Are You Arriving? Conversations with Cristina Young. After 13 years of leading weekly parenting groups, I'm bringing my favorite question to the mic. How are you arriving? These honest conversations go beyond small talk into family dynamics, parenting, wellness, tough decisions, aging, and what it means to live authentically. If you're craving real talk with heart, you're in the right place. Well, welcome back to How Are You Arriving? I'm delighted to have Dr. Olivia Mechanic in person, in studio. Yay! Welcome, Olivia.
Thanks, Cristina. It's a pleasure to be here. I've been looking forward to meeting with you for a couple months now.
So delighted that you said yes. So let me start with a little bit of information about Olivia. She's a Harvard-trained physician practicing cardiology and primary care in Miami Beach. I'm so grateful that it's really easy for me to get to your office. I had 3 friends who all started seeing you before me and were like, this is your person, stop everything, change everything, this is who you're going to. So well endorsed. Olivia specializes in identifying and treating disease and especially focus on healthy aging, longevity, and the prevention of disabilities stemming from chronic and cardiac-related diseases. She's committed to offering personalized patient care in an effort to promote a more health-conscious lifestyle. Olivia lives in Miami with her husband and 2 young daughters. Her house is actually kind of across the street from my studio here. So welcome, welcome. It's such a privilege to get access to your brain right now.
Thank you so much. It's my pleasure.
Tell me a little bit about your practice and tell me what it is that you do here in Miami Beach as a concierge physician.
So to tell you about my current practice, I should probably take a step back and tell you where I came from.
Yes.
When I first started practicing medicine in Miami, which was about 6 years ago now, I was in a traditional cardiology practice, and traditional means insurance-based, which also means that each visit with your doctor is 15 minutes long.
Oof.
And you can imagine that when you're meeting somebody for the first time, as a physician, it's really challenging to even scratch the surface in 15 minutes.
Very.
And that I found to be a huge limitation for the type of care I wanted to provide. So about 2 or 3 years ago now, I transitioned to what is called a concierge model, meaning I limit the number of patients that I see during the day so that I have more time and availability for them. I love to get to know my patients, and I like to know their families and their stories. And I think you as a physician can take better care of people when you have some time and bandwidth for them.
Absolutely.
And so my patients, not only can they come see me the same day, they can text me, they can call me, and really at any time. And it just allows for the practice of medicine the way it was intended to be practiced originally.
It's such a different model, but it's such a model of like, you want to know the whole person.
Exactly.
Not just that little symptom or complaint they're coming in with. And you must feel so much better about your work having made this change.
It's incredible. The amount of satisfaction. I always had a lot of professional satisfaction.
Yeah.
But now it's just so much deeper.
Yeah.
And I have so much more to give my patients.
So much more.
And then I have more to give when I get home too.
Of course. Of course. Wow. So what were the experiences that sort of sparked this passion for focusing on longevity and healthy aging? Where did that come from?
I think the basis for my interest in healthy aging or longevity medicine is rooted in the fact that I am trained to take care of some of the sickest people in the hospital. And when your day-to-day is or has been seeing the sickest of the sick, you start to ask yourself, what can be done
Yes.
when we're still at the other end of this health spectrum
Yes.
to prevent this sort of decay?
Yes.
And that has really led me to think a lot about, okay, modern medicine has made it so that we are living longer. Definitely. There's no doubt. Now, how do we live better? How do we age better so that those golden years that are truly supposed to be golden, but sometimes aren't, how do we preserve that colorful aspect to them? How do we preserve our vitality during that time?
Yeah.
The other thing that really has inspired me, there may be a couple of other things. And these are a little more personal, when I was on my maternity leave with my second daughter, my boss sent me a book as a, here's something for you to take a look at while you're away. And the book was actually called Outlive, and it was by Peter Attia, who's a well-known longevity expert. And I read the book twice. It really reframed the way, now that I had kids, the way that I thought about how I was going to start aging, especially in that postpartum period.
So interesting. Life is always about timing.
It is. It really is. And it was around that time, maybe a few months after she was born, that totally healthy person. I've always been thin. I've exercised to some extent. I try to watch what I eat. One day I was lifting up the baby into my husband's Jeep, which is elevated. And I found she was a little kettlebell at the time, which shouldn't have been hard for me. But I found that I was struggling. And that surprised me. But more than that, it scared me. I said, there's something seriously not right, not optimized here. And that's when I started this deep dive into what about muscle mass? What about sleep? Am I getting the right nutrition? It's not just the calories, it's the quality of calories. And applying all that to myself gave me more inspiration to apply that to my patients. So beyond standard primary care.
Of course. So I'll remind you that this interview that we're doing is part of a series I'm doing on passion-driven work. And it's why I thought of you when I was sort of crafting this series, because it's the people doing the passion-driven work are the ones where they experience something themselves. And that is the thing that motivated them to say, actually, I would like to make my entire career about this thing, because I know either how hard it's been or how beneficial this is, or there's some personal element of it that motivates them. And it sounds like this is surely the case for you.
Without a doubt. Without a doubt. Once I started learning about all of the things that I could be doing better, and the fact that I was a trained physician and was so unaware, if you will, I said, I have to start incorporating this into my practice, my way of life with my patients. And that has been my greatest satisfaction, I think, going beyond the annual blood work, the annual physical exam. This is so much deeper.
Question for you. When you did your training, did anybody use the word longevity?
No.
I don't even think it existed, right?
I don't think so. I think longevity, we started using it probably more mainstream post-pandemic.
Yes.
I would say I didn't hear longevity till 2021, 2022.
And now it's everywhere.
Yeah.
It's everywhere. Yeah. Wow. Okay. So you've kind of answered this already. I'm thinking about this sort of mission of yours of extending lifespan, but more, how can I intervene early so that the quality of others' lives improves? And it's something I think about a lot in my own work, is the difference between living reactively versus proactively. And when we can find the time to sort of step off the treadmill and look at, okay, I'm going to survey everything I'm doing. How can I intervene proactively? How can I get ahead of potential problems? It really gives us quite an advantage and such a different way to manage our life than to be in the practice of looking backwards and just reacting, putting out fires. How do you teach that approach to your patients? How do you convey that?
I think the Probably the biggest barrier that I see in my practice to health span or optimizing, increasing the number of good years, and particularly in my women patients, is the deprioritization of ourselves. And so the foundation must be built on the idea that we must make time for ourselves.
Right.
We are getting pulled in so many directions. Work, the kids, if they're not little, they have bigger kid issues
That's
that
right.
you're worried about, right?
Yes.
Even when you're trying to sleep, you're thinking about your subconscious is processing the kids, the family, your marriage,
Everything.
the mental gymnastics we do with the schedules, right? So the first thing is saying, you are allowed to take time for yourself and you must take time for yourself. This is a non-negotiable.
And by the way, you might be the only person in that woman's life saying that, giving her permission in that way.
Absolutely.
It's not common.
No. And it's not that other people don't want to give us that permission. It's that they may not have the awareness that we need some space for ourselves.
Do you think that most people, when you begin to speak to them about anything related to longevity and really focusing on quality of life, are most people open and interested in sort of in that tell me more stance?
Yes. I think most people, and I think it's human nature, we all want to improve.
Yeah.
We're always looking for growth in some capacity. And so when I introduce this concept of let's take care of you, let's build you up, right? Let's get to our best selves where we feel good. I think there's a lot of excitement around that.
And I'm curious to know, when people are with you, they come in for an appointment with you. I would imagine a lot of people are there because something has already happened in their health. So it's more of a reactive appointment, and they say, oh my gosh, I need to see Olivia. This doesn't feel good, or I need this test or whatever. How do you build in enough time to do the proactive and the reactive with your patients?
People come from different places for sure. Oftentimes they'll either have had a personal health scare or they have a family member who's going through something.
Okay.
And that's when it's the time, usually if it's the person themselves having an issue, we look into it. Ideally, we get it resolved. And then we say, look, your body is clearly telling us that you need a reset or you need X, Y, Z. And that's when it's a great a starting point or jumping board to really get into that next phase of being proactive.
And I think if you have somebody that you care about, a family member or friend going through something, it's the greatest motivator of all to say, I better get that checked out for myself.
Without a doubt. So many people will, those moments trigger us to think, I have to take care of myself because they might need me. I might be in a position where I need something or someone, and I want to be as healthy as I can be if it's possible.
Yeah. Yeah. What is it that helps you stay grounded sort of in this tidal wave of information right now about longevity? I feel like every podcast I listen to, every article, every book, it's everywhere. And I have so many questions about it, because part of what I see about longevity thinking is it seems like it wants us, the patient, to take more responsibility, to take it into our own hands. So you're going to track this, you're going to track that, you're going to track that, all the biohacking. It's an interesting shift where it used to be, at least it seems like it used to be more like, no, the doctor will be the one who's responsible for telling you to take that supplement, change this habit. I don't know. What are your thoughts on all this?
You're absolutely right. And a lot of this change and relocating the responsibility into the patient's hands, I think, is the result of the booming the wellness industry.
Huge.
All the influencers, take this supplement, do that. The way I stay rooted is I try to stay focused on the science, and I try to stay focused on data, especially because people count on me. It's not uncommon that I'll have a patient send me an Instagram reel where they're advertising a supplement or a workout. And they'll say, what do you think about this? Or maybe naysaying a medication, right? A traditional medication. And I feel that it is my responsibility to make sure that I'm giving my patients the most credible information that I can so that we can make an informed decision together.
And that's probably not coming from Instagram.
It usually is not, yes. Although, there are a lot of influencers out there that do give reliable, reasonable data, but there's so much to go through that it's hard to figure out what's what.
Yeah.
What I do try to tell patients and people in general when they ask about it, because I do love to talk about this, you might notice, is that this whole longevity and health span thing, it really cannot be hacked. It is work.
It's work.
It is work. And by far and away, the number one and the number two most important things we can do, supplements aside, or peptides aside, is diet and exercise. There is nothing that tops that. And that is work.
I was going to say, but no one wants to hear that.
Nobody wants
Everyone's
to,
like,
right.
No, where's the supplement? Just can I do something quick?
Exactly. The hack, I hate to dispel the myth, but this whole concept of hacking it, there's no way around it.
But the human brain is lazy. And we love a good hack. We love to feel like we're cheating the system. Like, no, I got it figured out. Let me tell you this hack. It feels so good when you, but yeah, usually whatever the hack is, and usually it's coming from an influencer, maybe it works once, which by the way, then is like, well, was that actually something that worked? Or was that just a random circumstance that it worked in? It's not reliable. It's not reliable.
Yeah.
So let's talk a little bit about this notion of passion-driven work, because when I think about somebody who's driven by a passion, and that is the thing that gets them out of the bed, it inspires their career, there can be dips in that passion. There can be obstacles that come along that on occasion might even make you question your choices. Can you tell us about a dip or an obstacle, and also what kind of resilience or coping skills you would use to manage that dip?
When I think about obstacles in general, professionally, I would say that I have been in a very supportive environment, but if I told you that it's as easy for a woman to be a cardiologist as it is for a man, I would be lying to you.
This sounds ripe with stories. I'd like to hear.
Yes. There have been times where I have felt that I may have been treated differently because I am a woman, right? Or things have been said to me or about me because I'm a woman physician, and I am definitely not of the personality to poor me. I try to not make it about my gender, and that is part of my daily mission, right? My mantra is like, I'm a great doctor. And I think being a woman sometimes makes me a better doctor, being able to relate to people. And those gender themes are recurrent in my profession, unfortunately. Actually in cardiology, about 10 to 15% of cardiologists are women. So
that's so small.
It is tiny. Wow. And it makes me very proud to be able to do what I do.
Yes.
But we women cardiologists, we do feel that there are some challenges.
It makes me understand even better what you said a moment ago about really relying on the science and always arriving equipped with data, so that when there are naysayers, when there are people who are trying to say, well, she's just a woman who's trying to make it in our field, it's always makes you seem more legitimate when you're like, well, yes, but did you see that study that was just released? It shows I'm here. I'm not going anywhere. And I know that the data and the science are rich and support all of my choices and make me a real legitimate doctor here.
Absolutely.
Yeah. It must be fascinating. Your whole world is very fascinating to me. Let's talk a little bit about resilience here, Olivia. How do you encourage resilience? How do you help either teach your kids resilience, find resilience in yourself, encourage your husband with things that are tricky for him? Resilience is definitely part of this whole package of passion-driven work. I think we have to rely on resilience a lot. Do you have certain habits or certain things that you do, or you mentioned a mantra already, things that help sort of strengthen your resilience?
I think I have been taught to be resilient maybe since my childhood, and it's almost ingrained in my psychology.
Can we pause you there? And who do we get to thank for that?
My mother.
Yeah.
My mother.
Tell us a little more about your mother.
She is, to me, the most incredible person. She is a Latin American immigrant who came to the United States as a teenager, not speaking any English, and worked while she went to school at night to learn English.
Oh my goodness.
Literally came with nothing, put herself through college.
Wow.
Got a degree in microbiology. And I mean, she was able to do that while she had me. So, I mean, if that's not resilient, I don't know what is.
That is incredible.
And so much of my daily inspiration comes from her, the person that I am, that, a lot of what I think is, my dad used to tell me, the sky's the limit, right? That's how I grew up thinking about things. And so when it was like, okay, I'm going to go to medical school, getting into medical school definitely is not easy, right? But it was that psychology of, we have to keep going, right? And the opportunity of living in this country and being privileged to be born here and have opportunities my mother did not have, right?
Yes.
Making the most of that. And my hope is that I can pass that on to my kids. One of the reasons I work, besides the fact that I love what I do, it's very important for me to have my daughter see mom going to work and doing something that she feels is important to her.
Yes.
Because I think that if they see that, they will not only look for something that they're passionate about, but they'll hopefully understand the value of hard work and overcoming challenges, because I do have challenges every day, right? And if they see me deal with them and confront them and address them, I hope that that's the best example I can give.
I want to talk to you about an organization I really admire here in Miami. If you're looking for a way to make a real difference, LEAP helps formerly incarcerated women, many of them moms, rebuild their lives through in-prison education, safe transitional housing, and job training. Learn more at leapforladies.org and be a part of a woman's second chance. What incredible insights. First of all, your mother sounds amazing.
Thank you.
And your mother normalized for you that women work hard and women aspire to big things. And it's such a gift that she gave that to you and you became aware of that at such a young age. I mean, that's the filter, obviously, through which you see your life. And that filter is so important. And it's like a massive gift that a parent can give to a child.
It is.
So bravo,
it's a foundation.
Mom. Well done. That's incredible.
Yeah, great job, Mom.
Great job. Yeah. But also I want to give props to your dad. Like that's exactly in my work as somebody who supports parents, like that's what you want to say to your kid, the sky's the limit. Like, go get them. Do what you want to do, right? I mean, that, because you're like living proof of what it looks like when a kid is filled with that kind of information and that tone and that spirit in the house. It's remarkable. It really makes a huge difference.
I will have them to thank for that for the rest of my life.
Thank you for sharing that. I love hearing that. So let's talk about, if you have a story, something where, whether it's from quite a long time ago when you were in more traditional medicine or something from your concierge practice, a story where you can remember having a real ripple effect on someone's life. Time when you really made an impact and it stands out to you in your memory.
I do. I'm trying to decide between two.
We can hear two.
Yeah. So I'll give you two very extreme examples because they actually might be really helpful.
Yeah.
The first example is of a patient who I met him maybe 3-4 years ago. He was young. He was 47 at the time. Mm-hmm. I met him shortly after a massive heart attack. Oh. That came on very suddenly. It was unexpected. He was a very hard worker in the entertainment industry. He had done very well. Okay. But his life was, I would say, highlighted by sleepless nights, because in the entertainment industry, he had to be up at night. Okay. He was a smoker. He was overweight. There was sort of it was a ticking time bomb. And when the heart attack happened, He was shocked, devastated, I would say.
Yeah.
And then the thing that we don't see about the heart attack is modern medicine and modern cardiology can take care of the heart if you come in soon enough, which he did.
Okay. What is soon enough with the heart
Soon
attack?
enough. So ideally, if you're feeling symptoms that you think might be a heart attack, chest pressure, heartburn even, and in women, we're different. We have other symptoms that men may not have. And the textbooks are written about the boys.
Of course they are. Can we run down the symptoms for a heart attack for a second?
Absolutely. So for women specifically, you can have a vague chest discomfort. You can start to have unusual shortness of breath that is typically starts with exertion, but can be at rest. Some women even describe subtle nausea, just feeling meh, if you will. So what I encourage women to do is, when I tell them, your symptoms are not the classic symptoms you see in the movie where the guy is clutching his chest. If you have any concerns, go to the hospital.
Yeah.
Don't wait it out at home. And ideally, you want to be in the hospital within an hour. Within an hour of symptoms. And some people don't know these symptoms are vague. It could be my heartburn. I'm going to wait.
I think my whole thing would be like, look, I'm sure it'll pass. Let me wait it out.
Right. Which many of us do.
Okay. But we want to get in there within an hour.
Absolutely. The minute you feel this is not right, this is not me, you want to think about getting to the hospital.
Okay.
So he had made it to the hospital within a reasonable amount of time. He was treated. We got to the point where you're going to be fine. And I see him in my office for a follow-up visit. And we're talking about, we're going to have to make changes in your life, serious changes.
Yeah.
And again, the concept of this is going to be hard, right? It's going to be hard to quit smoking. It's going to be hard to start exercising, especially for someone who had never exercised ever.
So hard.
And when we talked about the gravity of what had happened and what could have happened, but thankfully hadn't happened, he just broke down in tears. And he kept apologizing. I'm so sorry. And I was like, listen, let it out, because part of the battle is the emotional one. There is a component of almost PTSD after an event like that.
I can imagine.
That we don't talk about.
Yeah.
And so I like my patients I like to bring it up, and I like for them to just let it out, because there's a mental component for sure.
There's gotta be. It almost, the word betrayal comes to mind, almost of like your body betrays you. You count on your body, you stay up late, you're smoking, you're doing your thing, but you're like kicking it.
Yes.
And then your body's like, this isn't
done.
working. We're not going to have a heart attack now.
He had to change his life totally around.
Wow.
He had to stop. He had to set a bedtime, because he couldn't be, working all those nights.
Yeah.
He had to quit smoking, which was extremely challenging for anybody who's ever smoked. They will know how difficult that is.
Yeah.
And for the first time in his life, after almost 50 years, he had to start exercising, and it was all thrown at him at the same time.
Did he have a fabulous support system, I hope?
He had grown kids who were very supportive, but a lot of it, he really set his mind to it. And I would say a lot of it was his hard work. He would sometimes, when I would tell him, look, we need to introduce a no medication, he'd get upset. He'd be like, I'm young. I don't want to be on all these medications. And I'd say, but they're good for your heart. And so we'd have a back and forth discussion.
Yeah.
I think the most gratifying thing is that maybe a couple of months ago, he wrote to me very early in the morning, and he said, hi, I just finished my tennis, because now he plays tennis regularly, which is a great workout.
It's like been voted the best sport of anyone for our lifetime, right?
It is amazing.
And I wish I played. Yeah. I don't play. I've tried. I've spent so much time on lessons. I have no eye-hand coordination whatsoever. But I'm so envious of people who play.
Yeah. And
it's the cardio aspect of it and the camaraderie, the social, all combined into one nice sport.
Exactly. He's developed a nice community of people he plays with. Great. And so he writes to me and he says, I just wanted to let you know, I've just finished my tennis for the morning. I haven't stopped in this amount of time. Even when I'm traveling, I'm finding time to exercise.
Wow.
He had lost a ton of weight, and he was like, just want you to know, I appreciate you. And it wasn't the fact that he said, I appreciate you. It was the fact that he realized how much he had achieved.
Yes. Because like you said, that is hard work.
Yeah. And it's not for the faint of heart.
It's not. It's physical work, but it's very much mental, emotional work. But it's also, you have to imagine he was scared.
Yeah.
And, I spend a lot of time in my work talking to clients about what motivates them. And fear, unfortunately, can be a really big motivator.
Absolutely.
Yeah. Wow. It must be so gratifying to you when you develop that rapport with someone, you help them through a very difficult time. And like you said, they get to the other side and they feel proud of themselves, so much so that they want to thank you for your support. And that's gratifying work.
Makes your day.
It really
makes
does.
your career.
It makes your
Those
career.
people.
For sure.
Those people.
For sure. So let's talk a little bit about this. We've talked about how longevity is kind of everywhere now. I'm curious to know, how do you strike a balance as a doctor between the things that work, that have worked for a very, very long time in medicine, and all of the new, modern, interesting, exciting, trendy things that are coming in? What are your thoughts on that balance?
I think the way I think about this is that the things we know and have known for a long time, diet and exercise, those things should be the foundation.
Yeah.
And the way I parse through the new stuff is I start to look, I really have two criteria. Okay, what are the studies for supplement X? Are there studies in human? And assuming there are they good quality studies? And have they shown a benefit for what we want to achieve?
Yes.
Which a lot of times in the longevity realm may be anti-inflammatory effects, antioxidation, that type of thing. And then the other arm there is, could this harm someone? And that's really the deal breaker. When something could be harmful, that's when I'll tell my patients, I think we should pump the brakes here.
Yeah.
If it's not going to be harmful and there's some reasonable data, I tell people I think it's reasonable, right? And it's always a case-by-case discussion. But it is a little bit challenging to find for some of the cutting edge things that are being brought to our attention, enough substance to support it.
Do you I'm thinking specifically about a container of creatine that is sitting on our counter at home. I am not taking creatine yet. I've been on my list of things to do to ask you, but I'm going to ask you right here.
Great.
My husband is taking it
Okay.
because a friend of his from college was like, dude, you got to take creatine. My husband's not the type to do his own research and be like, well, let me check all the studies. He's like, okay, you're taking it. I'll take it. Great. But I walk by it every day and I'm like, am I supposed to? And I hear a lot about creatine, but then I also feel like I've heard mixed things. So please, Dr. Mechanic.
Absolutely.
What is your view on creatine?
Creatine, you actually gave me one that's a little bit easier for me because creatine actually has a decent amount of data behind it in terms of safety and efficacy.
Okay.
And so when we talk about creatine is a supplement that when taken once a day, usually the doses are between 3 and 5 grams. They can help supplement muscle growth or hypertrophy, which is most of us are looking to increase a little bit of muscle mass for health reasons, bone health reasons, for strength reasons, for those later golden years, right? So creatine can actually be beneficial, reasonable data, when it's paired with protein. Protein is really the secret sauce.
Okay.
Protein, I would say, is more important than creatine, making sure you're getting enough protein.
Yes.
What enough protein means for each person is going to depend on your medical history and your size in terms of weight. But when you pair creatine with protein, you may get a little bit more bang for your buck in terms of muscle building.
Interesting. So my husband's not doing that. Do you mean at the moment you take the creatine, you're also having some protein?
So protein should be distributed evenly throughout the day.
Yeah.
The timing of the creatine doesn't matter as much. What matters the most is that you're taking it daily, even on days where you're not exercising.
Okay.
What you want to achieve is a steady state of creatine and not so much those peaks and valleys for it to be most effective.
But our bodies produce creatine. Is that true?
I believe so, but not
nearly enough.
Right.
And so if we augment, which is what a supplement is augmenting, then it produces the effects of enhancing muscle, maintaining muscle, or
Maintaining and also encouraging a little bit of hypertrophy, which is growth of the muscle.
Okay, so this sounds like we're endorsing creatine here.
I'm all for it.
Great. Okay. What do you have a certain brand that you love, or we can talk about that later?
I will definitely send you the name of the one that I personally use.
Okay. Fabulous. I love it. I love it. Yeah. So for listeners who want to live longer and better, I think I already know the answer to this, but I'm curious if you would add anything else. It sounds like exercise and nutrition are the two main things that you're going to push. Is there a third thing, or is there a way of exercise and nutrition? Is there some kind of angle that we don't normally hear, or something that you found even that's worked in your life that you could offer listeners?
2 additional things I'd add to the exercise and nutrition are sleep. Sleep is so important. And so many of us do not get enough quantity of sleep or quality of sleep.
Yes.
So prioritizing sleep, having good sleep hygiene is a great place to start. Yep. The other thing is the mental health piece and having meaningful relationships piece and time to build these meaningful relationships piece, because the mind is a crucial, and the wellness of the mind is a crucial aspect of this longevity topic. When you look at people who live longer, one of the most common recurrent themes is that they have a sense of community, even as they age.
Yes.
Whether it's friends, family, they have some social interaction, which adds to that vitality and reinforces everything else that you're doing to keep yourself strong for these later years.
It is remarkable how consistently I see that piece of information, that it's the connectivity that allows for longevity. And it's so, I find it to be like the most comforting piece of information, because it's so true when you look at the way that you spend your time. If you track your time, let's say over a week, and you give yourself a score of like, okay, from 1 to 10 on levels of happiness, and you look at where you score highest when you review all that time that you've tracked, you'll see that it is always, not always, but most of the time, it is when you are in interaction with another human. Of course, there are times when it is absolutely delightful to be alone and rest and just be saddled with your own thoughts rather than exchanging thoughts. But it's the consistency with which that information keeps showing up, at least in my life, where I see it. We are here to connect. That's why we're here. And that's how we're going to find the best stuff out of life. It's very reassuring to me. So just before I let you go, I'm curious about the mental health aspect, and are you in conversation with your patients about, would you typically survey them a little bit, ask them questions? Are you doing depression surveys? Is that a standard part of a wellness checkup with you?
With me, absolutely.
Okay.
That's something that I dig into, everything from what are your stress levels?
Yeah.
And for most people, they're medium to high.
Yeah.
And what are the sources of stress?
Yes.
Are they interpersonal issues? Are they family issues? Are they work-related, financial? Understanding that, and then going into, how about anxiety?
Yeah.
Do you feel depressed? And depressed doesn't always mean sad.
Yes.
Depressed could be, I don't feel like doing anything.
Yeah.
Apathy.
Yep.
Right?
Yep.
Uncovering those things, because if you let those things kind of simmer, they will show up later. They will show up later. And so a good longevity assessment will have a reasonable mental health component to it.
Yes. Yes. And I love that you're normalizing. When you come here in my office, we will be talking about these things. It is part of our whole dialogue.
Absolutely.
It's great. It's great.
It's important.
Yeah. So before we end, I would love to know what you feel most hopeful about in terms of your passions, your work. What do you think about in the future that gives you hope?
I'm really hopeful that there is this movement now toward, okay, I don't want to react to things once they've happened. I want to work on staying healthy or getting healthy to prevent things. Yes. And that switch that has really come through in sort of pop culture, if you will, or our day-to-day is actually reaching the medical establishment, which also has been more traditionally based on taking care of things once they've occurred. And once the unfortunate things have occurred, being reactive. I'll give you an example. In training, most of the training takes place in the hospital once the patients are sick. Very little of the training takes place in the clinic when patients are still well. And I think the medical community is recognizing that there needs to be a shift in the balance. And as doctors start to recognize that, and this new generation of physicians coming out realizes that we need to kind of shift some priorities, I think the message will get out even more.
That whole notion of preventive care, it's, again, in my practice here, I speak so much about how can we be preventive and proactive in our parenting, because that is the best quality parenting. And it's when we have the most access to the best parts of our brain. And so often, especially I work with parents of teenagers, it's high stakes. And we're so often in a reactive state where we don't have the best access to the best parts of our brain. And that's when I always remind parents, like, that's when we rupture relationships, is when we're in a reactive state. And how to get parents to shift from that reactive state to the proactive really is so much a part of my mission in my work. And I didn't expect that you and I would align on that, but it's such a nice byproduct of this conversation. Absolutely. And it makes me happy to be alive at this time, to see in my field, but also in your field, there's that subtle shift in that direction. That gives me hope as well.
Hope is what we've got, right?
Yay. Thank you so much for being here, Olivia. I appreciate your time.
Thank you so much for having me. This was a lot of fun for me.
Thank you for listening to this episode of How Are You Arriving? Please follow me on Instagram at CMY Therapy. As always, like, follow, and subscribe. See you next time.